I'm joined today by Secretary of Health John Weisman, and he's going to help me talk about our state efforts of testing, which is very important in what you might think of as our new strategy to defeat this virus. As we reopen our state and move away from the strategy of social distancing, testing is a very important part of the sort of four-part program of testing, contact tracing, isolation, and using masks as something to protect ourselves and our loved ones. I think people know that our early struggle against this virus was very much hampered by lack of testing supplies. Supply constraints, particularly the constraints of not having enough of the testing kits themselves, have been constant. After months of our advocacy for the federal government to use its full powers to expand the production and distribution of these supplies, the administration reluctantly stepped up their efforts in late April. In May, we received about 2/3 of the testing supplies that had been promised by the federal government, and we're still doing the best we can against that backdrop, of course, using our own methods to try to obtain the test kits that are necessary to start the testing process. The good news, our testing capacity has grown. We now have done more than 350,000 tests in our state. But there is much more work to be done to fully contain this virus. And this is where our testing goals come up for this discussion today, because we know that we will have many more people that will need tests as we reopen our businesses and people are able to return to their workplaces and places of study. So today we are announcing a significant broadening of our testing strategy. Previously, the medical advice has been early in this pandemic, if a person has symptoms, to simply stay home. If they were mild, did not necessitate a test. But as more testing supplies have become available, we now have a new strong and emphatic message, and that is, if you think you're sick, please get tested. We strongly encourage people to do this, even if people are mildly symptomatic. This is a shift of strategy. It has been enabled by the fact that we've had more testing supplies to get this work done. We know that testing is critical. As I've indicated, it's the very first step in the four-step process so that we can move our state forward. It also helps measure our county's progress as they move forward through the various phases of our Safe Start effort. So I just want to talk about the folks who we need to get tested. First, if you think you have the symptoms, even mild, of COVID-19, please get tested. Second, if you are a household member of a person who has the suspicion of COVID-19 or has come into contact with someone, please get tested. Third, crucially, this will involve a wide variety of congregate settings of folks who we ask to get tested as well, including those of people where they live and work, where there is infection, and there are congregate settings that call for this action. This includes job sites like meat packing plants, agricultural sites, as well as close low-income housing, long-term care, homeless shelters, and similar situations where the risk of infection is high. Now, here's a really important point in addition to getting testing. While you're waiting for your test results, we need you to stay home until you get a negative test, and that includes people in your household. We can't emphasize enough why this is such an effective way of breaking this transmission, chain of transmission. And the reason for this is that the new science shows how much of this transmission occurs early in the course of the disease. The science now has made clear that much of the transmission can occur before people really even have symptoms. So the need, if you do develop symptoms, to stay home immediately, even before the test results come back, you can really help our community and your families and your loved ones and your people you work with. So we hope that people can do that.